If you look at the important issues of the day in this country, certainly the state of healthcare is one of the handful of the most important issues of our day. Most reasonable people would agree on a lot of the important elements of healthcare today. They would agree that healthcare technology is better than it's ever been at any time before. They would agree that people today probably are taking better care of themselves than they ever have before. People are living longer, but people also know that because people are living longer, because there are these advances in healthcare technology, the costs are going up, and the healthcare system that was devised in the first half of the 20th century is really showing some signs of strain as to how survivable it'll be throughout the 21st century.
Here at the 20th Annual Emerging Issues Forum, the public and private sectors have come together to propose solutions to one of the nation's most intractable public policy dilemmas. Across the state, citizens and companies alike are struggling to tread water in the rapidly changing U.S. healthcare system. And though these struggles may seem distinct, they feed each other in a cycle of rising prices, increased litigation, and diminishing standards of quality care.
How do I feel being in the situation knowing that an underinsured or uninsured patient will get billed the charge, whereas another patient, same problem, with an excellent job and an excellent insurance policy his insurance company will see the charge, and I will collect a fraction of that charge and call it a deal. I don't like that. I take care of a large number of absolutely wonderful human beings who don't have a great deal of money. I have no control over the charges that go out. The healthcare system has rewarded technical procedures more generously than cognitive procedures. That is, if I do something per unit of time I spend doing it, I will be more handsomely rewarded than if I spend that same amount of time talking to you and thinking about your problem and fashioning a long-term care package for you. But the system, as it's currently structured, does not encourage people to spend their time that way.
I was at home. It was on a Monday morning, and I received a phone call saying, "Don't come back in." It's hard to see a community that I live in where a majority of us work for pillar tax. You couldn't prepare me for it because it's something that's been around all my childhood, and that's all I knew as a child is working for pillar tax.
And it wasn't until well into the process that I realized, I was part of the crisis as well, but it was more so with the loss of my husband's employment and, the loss of our insurance benefits. I think that's the main thing. I made some sacrifices I'm not proud that I did in regards to my medication. Skipping dosages is not healthy. It's a sacrifice that one should not have to make.
I would love to see people be able to get medical coverage, get their medicines, and not to have to make a choice between whether or not to have a roof over their heads.
This clinic itself is approximately maybe 20 miles from Asheville, or about a 20 to 25 minute drive.
And our county is rural. We still have tobacco farmers, fewer and fewer. We still, again, have more seniors and more folks in poverty than the rest of North Carolina.
But I used to be real strong, but I'm not now.
Ms. Stackhouse, as far as I know, has been a patient through the Hot Springs Health Program as long as we've been in existence.
You'll be surprised how you lose your strength. You wouldn't think you would, but you do. But I'm happy. God's been good to me. Oh, I've had so many blessings.
If this clinic were not here, I can't say that she wouldn't still be here, but she would be in dire straits. I really truly believe that.
Science is very, very seductive in that it's a daily effort of discovery. I think the added benefit here, in anyone in a pharmaceutical business is you're actually applying that sense of discovery and that excitement to a real-life application that matters for people. It's important to remember that it takes us 12 years from when we start a program to having a medicine for a patient. We really have to understand not where we are today, but what are the needs in a 15-year kind of time frame? What are the big disease issues that are going to be manifest at that point in time? Not only do we have an obligation to develop medicines for the United States and Europe, but we have an obligation to mankind as well. And North Carolina has a huge role to play in that. Not only is GlaxoSmithKline and a number of smaller pharmas and biotechs in this area, but we're recognized as one of the leaders in the world in the information technology and the high-tech sector. We have some of the world's best medical schools and training facilities here in North Carolina. All of those things are going to come into play to optimize healthcare.
If you go through my plant, you will see that most of our employees have been here for years. They are very smart, and they know that as painful as it is to pay for expensive health insurance, they know that it's a much greater problem to not have health insurance. And the problem we have in the manufacturing sector and companies like my own is health insurance premiums are rising at a multiple of the rate that wages are rising. Sadly, more and more small companies are starting to reduce benefits or drop coverage. The people I worry about most are those people that are between the ages of 50 and 65. They are not eligible for Medicare, and because they work and have incomes, they are not eligible for Medicaid, but yet they are at the most vulnerable point of the healthcare curve in terms of cost and insurance risk.
Our likelihood of needing medical insurance is going to grow if we're lucky enough to grow old. And I don't say that I'm old at 59, but I'm getting there. I don't think that most people in my age group would seriously consider retiring early and having to deal with finding insurance for themselves.
When I arrived at work today, the forces had landed. The 1st Carolina Force was here, 1st Health Force was here with their mobile diagnostic facilities. 1st Health has done an excellent job, and they're driving issues in Moore County that I do think are innovative, which are the things that are going to help to resolve some of the health issues that we have.
Back in 2001, we determined that there was a need, more so in smaller businesses, for an affordable healthcare coverage product. So what we did, because of the uninsured rate in small businesses being close to 50%, we developed First Plan. When we perform the health screenings, and we call them health fairs, we really market it with the employer and the employees to start them thinking about, okay, this is an event, my employer is going to allow me to take some time away from what I'm doing with my job and go visit the First Carolina Care nurse and the mobile health van and get screenings for cholesterol, diabetes, and blood pressure. Hasty Plywood is a very unique group. The employer is very committed to his employees. For us, from an insurer standpoint, that makes our job easier. With community development issues and economic development issues and healthcare coverage issues, they all tie together.
A lot of places at our wage rate do not provide health care. While this country is going through the evaluation of just what are the responsibilities of whom, it's our responsibility to kind of stand firm and to provide for the best wellness that we can for the people who we're involved with.
Up until 3 years ago, Bertie County had no Parks and Recreation program. Every county around Bertie County had a Parks and Recreation program. There was nothing here in Bertie County. The cost of Medicaid to Bertie County has increased 71% in the last 5 years. So our share of Medicaid cost has been increasing. It's not that Bertie County and the other counties like Bertie want to just reduce the tax rate and get this Medicaid cost away from our county so that we can cut taxes. We want to be able to provide other things for our citizens that so far we have not been able to provide. The Medicaid policy of North Carolina has a direct effect on our educational policy. As these dollars are flowing into Medicaid from, say, a Bertie County and not flowing into the educational system. It limits what is available to our students. 33% of our population is Medicaid eligible. We're a low-wealth county. It disproportionately affects our county because of our high Medicaid eligible population.
In terms of my view of the future, I am a realist at heart, so I do tend to see the challenges that we have to overcome, and they are numerous and they are especially daunting. But I have met enough providers in the state, I've met enough people who work for the state, who work for Medicaid, who work within the government, that I do feel like in North Carolina we are in a particularly good position because I think we have a lot of people with the right hearts.
Healthcare is a complicated issue, and the problems within the system seem almost insurmountable. We in North Carolina need to change that. In this state, we have some of the most innovative and highest quality health care in the world. And yet a lot of our people don't have access to it, and an awful lot of them can't afford it. We need to fix that. I believe that we have the assets and we have the will to accomplish this. And for North Carolina to lead the nation in making health care work better for the states.
I am North Carolina.
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 I am North Carolina.